I'm Chris, and this is my little one Lexi, and we are getting ready to clean her teeth, so she needs some pre-ops. We're going to start with pre-op blood work. That's going to help the doctors check her liver and kidneys to make sure that everything is functioning properly so that we can put her under anesthesia and know that there won't be a problem with that. Alright, so we have our patient Lexi hooked up to our EKG clips. They're painless. This just takes a second and we'll have our answers. But everything I have is laid on a heating pad, so we try to keep them warm while they're under anesthesia. We give them an induction of usually Valium and ketamine to help them go to sleep. Then we intubate them, which will allow us to keep their anesthetic and oxygen flowing directly into their lungs during the procedure. We also lube their eyes. Then we always place an IV catheter so that we have an open line as well as fluids to run to the patient to keep their blood pressure up, because it's very important when they're under anesthesia to keep your blood pressure high. And it's a great time to let us trim their toenails because they're asleep and they won't even know it happened.
Since most of the pathology we see in the mouth actually occurs at or below the gum line, it's important that we take time with every patient to evaluate the periodontal pockets, and that's the little space around the base of each tooth. To do that, we need this tool. That's a periodontal probe, and it has indicators on us to tell us what the depth is in the pocket around every tooth. So when we're doing our oral exam, here's how we use this tool. We go around every tooth, we evaluate the soft tissue, and we're measuring the pockets around that tooth to make sure there's not any infection or any other disease or any tartar that's left below the gum line.
Alright, so we've finished Miss Lexi's teeth cleaning. Her teeth are pearly white, her breath is fresh, she will be healthier a lot longer. And we're going to go into recovery, which means we snuggle them in a blanket, we put them back in their kennel with a cage dryer that heats and blows warm air around them to warm their body temperature back up and help them get wide awake. And our nurses always sit with them until they're on their feet and aware and we know they're completely awake. We always stay with them.